Hey everyone, it is Kevin Henry, the editor-in-chief for drbicuspid.com. Thrilled today to be continuing our CEO series through Cellerant Consulting and powered by Dr. Bicuspid. And joining us today is the CEO of Vigilant Biosciences, and that is Bill Brodie. Bill, how are you today?
I'm doing very well, Kevin. Nice to meet you.
Nice to meet you as well. I appreciate the time. Would you just take a moment and kind of introduce yourself as well as tell us a little bit about Vigilant Biosciences?
Sure, absolutely. I'm Bill Brodie. As you mentioned, I've been with Vigilant Biosciences for about 5 years. I've been doing a combination of dental and medical for over 30 years. At Vigilant, we are basically trying to detect oral cancer early. Our mission is to save lives through world-class early detection of oral cancer. And we're doing that through a combination of biomarkers and clinical risk factors built into a platform to give dentists the ability to not wait until it's too late, but to catch it early and save the patient's life.
And, I'm thrilled to be doing this podcast with you during April, of course, Oral Cancer Awareness Month. And I guess a big question I want to ask you is, I believe every month should be Oral Cancer Awareness Month. What can we do to get more of the importance of this out into the dental industry?
Yeah, a lot of it is awareness, Kevin. I think I like to say and sort of joke that oral cancer has a PR problem. Nobody thinks it's that big a deal until you read the statistics. There are more than 700,000 cases globally, new cases, and unfortunately, nearly 75% of them get diagnosed in stage 3 or stage 4, late stage. And that gives you less than a 50% survival rate. And the simple fact, it just doesn't have to be that way. If the signs are there and the tools such as ours are provided to the clinicians to catch it.
So tell me a little bit about the biomarkers. I mean, explain to our audience what that means and kind of what they should be looking for if they are working with you in your product.
Sure. So what we're doing is we're picking up proteomic biomarkers in saliva, whole saliva, chair side. So this is a real-time system to give the clinician the ability to make a decision on how to progress in care for the patient while they're still sitting in the chair. And the biomarkers themselves, so our approach is we're looking at it from two different ways. So one is a transmembrane biomarker that's exuded through the cells through rapid reproduction of the cells, of abnormal cells, just basically a hallmark of cancer, right? And then the other one is the body's attempt to suppress that exact activity. So we're kind of coming at it from two different sides, and then throwing in intelligent software to track clinical risk factors, age, gender, alcohol and tobacco use, and blending it all together in a machine learning algorithm that kind of gives them a probability, if you will, or a likelihood that patient is starting to exhibit cancerous behavior.
And obviously with the patient sitting in the chair while this is done, then the dentist, the hygienist, whoever is in there with the patient at this time needs to be prepared for what the next step might be, obviously, whatever the test may show.
Yeah, absolutely. The dentist all the time, right? They see patients with a orally potentially malignant disorder, right? Could be anything: leukoplakia, lichen planus, erythroplakia, red spots, white spots. And odds have it, it's nothing. But there's a percentage of the time when it is something, and the issue becomes you don't know which is which, and it's really hard to tell. World-class experts have a hard time just from the visual exam to say, okay, I know that's cancer, I know that's not cancer. And so the idea is give them a tool where they can say, okay, do I get this patient to a specialist or not? I like to refer, lichen planus is a great example. Dentists see it all the time. Odds have it, it's nothing, right? It's a less than a 4% chance that it turns cancerous. But if it does, it's extremely aggressive. Patient could be dead in 18 to 24 months. And so the question is, how do you find the 3 out of 100, the right 3? And so you need something, you need a tool to help you find that before it's too late.
And having a tool like this, I mean, as somebody who has a friend who's gone through oral cancer, I mean, I know how devastating it can be. But having something like this that can catch it as early as possible, as you mentioned earlier, early catching is such a key to this.
Yeah, that really is the promise of the product. And I think the problem with the disease, besides the disease, being horrible, and the patient outcomes are terrible. I mean, they could be disfigured, they could lose their ability to speak or swallow, and those are the unfortunately the lucky ones who survive. And so the promise is, let's catch it early. Well, you change if you catch it at stage 1 or stage 2, you change that survival rate to 80 to 90%. Not to mention avoiding all the lifestyle horrific part of it.
Yeah.
You just have a far better chance to live. And if you pick it up in say high grade dysplasia, which is basically like stage 0, like what we're doing, it becomes a much simpler thing to treat and not have the horrific outcomes.
We're on today with Bill Brodie, who's the CEO of Vigilant Biosciences, part of our Cellerant CEO series that we're doing here on drbicuspid.com. And Bill, you mentioned earlier that PR problem that oral cancer has. And I know so often the dental team, the dentists they don't want to talk about smoking, HPV. They're uncomfortable conversations to have. How do we get past those uncomfortable conversations to know that we're saving lives by talking about this?
Yeah, I think that's a great question, Kevin. Most dentists do not want to obviously tell a patient they have cancer, right. And that's why we've kind of set it up that actually is not what they need to do. I mean, only a specialist and pathology are going to give them a definitive diagnosis. What we're trying to do is give them a decision tool at the moment that the patient's in the chair, real time, to say, more definitively, yes, I need to have you go see, a oral surgeon, or I need to go have you see a specialist, and you need to get a biopsy because we need to find out what this is. And so they don't have to tell them that it's cancer, but they do have to tell them what the care pathway is. Okay. As opposed to, let's watch that, let's see what happens. Maybe you should have it checked out. That patients, don't necessarily follow through on that. I wish I knew the stats, but I've heard anecdotally that it's like 50-50 that the patient will be like, yeah, I don't really want to go, because they don't want to know either. But you need an objective tool to tell them that, yes, you need to have this checked out.
And I love that you use the term watch, because I know so often that's a word that's used in praxis. And I think in the patient's mind, then they don't think it's that big a deal if they perceive that it's not that big a deal from the dental team.
Right. I mean, that's the natural dental, right? My father was a dentist. I grew up in dentistry. You go to the dentist and they're like, oh, we're going to put a watch on that tooth, right? And and you hear them say it. And as a patient, you sort of write that off, going, okay, well, he'll tell me when it's a problem.
Well, tell me about the company itself, because I know if I go on your website, and we'll give the link here in a little bit, that I know that at the moment this is not for sale in the United States. So what is kind of your plan over the next 3 to 5 years with this product?
Yeah, so we are FDA pending. We received early last year the FDA's called Breakthrough Designation, which is basically a special program by the FDA that recognizes that the test has a promise to be better than the current standard of care. And so in the meantime, we are also going commercial globally. So we treat this as a global issue. So it's not just U.S. In fact, the prevalence, as you probably know, is much higher outside the U.S. And so we are currently just completed our limited launch, and we're about to go full launch in the UK, Germany, and Italy. So in Europe. And then we're opening up markets in the rest of Europe, the Middle East. India is going to be a huge market for us. It's the most prevalent and largest oral cancer market. So we're working with multiple possible hospital chains, dental companies, and things in India. And then we'll go after the rest of Asia later. So with the goal of impacting that survivor rate. That's the big thing.
So as the CEO of a company that has global reach, how do you make sure that your product, kind of keeps moving ahead and hitting those goals that you have? Because again, we're not just talking about one market, we're talking about multiple markets across the world.
Yeah. And we have, there are multiple things. So we have a very good R&D team. They do a great job. We picked these 2 biomarkers as a starting product. And then the idea is we have probably 20 other biomarkers in the works that we've either tested. And what we've realized is there's a signature for oral cancer, and you need to blend biomarkers. There's no silver bullet. There's no one. And so we continue to do research. We continue to work with our partners. We're working with excellent dental schools in the U.S. and Europe, and hospital systems now in India. to find patients that have cancer so we can perfect the product. The beautiful thing about being mostly software driven and kind of machine learning is the more data we have, the more accurate the test will get.
So I've got to ask, AI is all the buzz right now. Is there
Yeah.
any relationship between AI and what you all are doing right now?
Yeah, absolutely. Really, it depends how you define AI, right? It's a big buzzword. But I think by the basic definition, with the fact that we are blending uh, characteristics of biomarkers, so it's really not just the biomarkers, it's the exact concentration of those biomarkers, how they interact with each other, um, how quickly they bind antibody to antigen. All that's taken into account. We actually even have an algorithm that adjusts for age because some of these biomarkers increase as you get older. And then you blend that with the risk factors that I mentioned, gender, because males are about twice as likely as female, and then alcohol, tobacco. And you blend that all together into what is a simple, actionable result of basically, does the dentist escalate care or not? That actually is AI, kind of by a definition, right? Because you're blending it together. And then the machine learning part comes in where you have the ability to make it more accurate by just feeding it more data.
There you go.
Yeah.
So let me ask you, because during this series, I've loved to kind of pick the brains of the CEOs that we've had on and your business mindset. And I'm curious, what's the best piece of business advice that you ever received that kind of helps guide you day to day?
That's a great question. Very good question. I think to come to the realization that the CEO kind of really only has three jobs or three main goals. One is to set the strategic direction for the company. So I kind of think that's the most important. And with that comes the goals and every departmental goals plus company goals. Two is to get the right people in the right seats, right? So the right seat on the bus so they're pointed in the right direction. And then lastly, and the least favored of every CEO probably is the fact that you need enough money in the bank to be able to pay those people to let them do their jobs and get out of the way. That's I heard that advice and I'm like, actually, you boil it all down, that's probably pretty true.
That's pretty good. I like that. And honestly, because I always love to ask CEOs kind of their business mindset into the dentist mindset as well, being the CEO of his or her practice. And it seems like that kind of would make sense for the dentists who are listening and running their own businesses as well.
Yeah, I think so too. I grew up, my father was a dentist, right? I mentioned that. And I've known a lot of dentists. I've been in dental. I was in purely dental for about 15, 16 years. And so, I think it is. I mean, you have to look out for what the good of the correlations are. Look out for what's good for the company, and that will ultimately probably work out for yourself. It's not about you; it's about the team. And same thing. The dentist is looking for what's good for his practice, but he's also what's good for the patient, what's right for the patient, and that'll ultimately work out. And by the way, that's a big part of our product. That's why I think we're going to get good adoption. By the way, is because simple fact is it's the right thing to do for the patient.
And I love that. You boil it down, and that should be such a decision maker in and of itself. Is it the right thing to do so often? So that's fantastic. And another thing I love to ask CEOs during the series is about the think tank that is Cellerant Consulting and kind of having to bounce ideas off of other business leaders. And how important is that for you in your position?
It's very important. First of all, Cellerant has been fantastic to us. They're great to work with. I really think they're one of the big advantages of them is their connections. Lou and how he knows everybody in the industry, and the fact that you get to bounce ideas off of. We literally did a session yesterday about website and landing pages and things, and their feedback and their mindset is very collaborative, and it's just a great resource to have.
So let me make sure people know where they can learn more about your company and kind of keep an eye on where you're going and how you're raising the standard of care in dentistry.
Yeah, thank you. It's so our website is vigilantbiosciences.com. They can go on there, they can register, they can download some of the white papers we have. And then I know Cellerant is working on multiple articles, including this podcast. So I think there's going to be a lot of content coming out soon.
Well, and again, we're doing this during April, Oral Cancer Awareness Month, but it's something that we have to be focusing on the other 11 months out of the year. So, Bill, thanks so much for what you're doing behind the scenes to make sure that standard of care is raised.
Thank you, Kevin. I appreciate it.
And thanks to all of you for listening to this episode of the drbicuspid.com podcast. We're working with Cellerant Consulting to kind of give you a clue of what's coming next into our industry. We'll be back soon with another CEO and another interview that's going to show you some things that you're going to be amazed at coming your way.